When you go home, you will use the CADD infusion pump. This video reviews the steps for how to disconnect your CADD infusion pump with the Optima Closed System. Before you disconnect, gather the following supplies: 2 pairs of gloves, a plastic bag that zips closed, Optima injector. You will receive one from the unit where your pump is connected, clean towel or absorbent pad, pre-filled normal saline 10 milliliter syringe, chlorhexidine device swabs or alcohol swabs, and heparin 2 milliliter syringe if directed. Place them on a clean surface. Use the small clean towel or pad on a tabletop. Next, wash your hands for 20 seconds with soap and water. Dry your hands with a clean paper towel. Put on 2 pairs of clean, disposable gloves, one on top of the other. When the infusion bag is empty, you will hear beeps, and the pump screen will show reservoir volume 0, pump stopped. Press Stop to silence the alarm. Press Acknowledge. On the right side of the pump, press the power button, then press Yes to power down pump. Remove batteries from the pump. Next, you need to release the cassette. Push down on the cassette latch until cassette detaches. Remove the cassette, which holds the tubing that is attached to the empty bag. Now you are ready to disconnect. Close all clamps, including your IV catheter. Remove the outer blue clamp by lifting up on the secure lever as shown, and remove tubing connection from the blue clamp. To disconnect the Optima injector from the Optima connector, pull the injector straight back. Do not twist. Be sure to keep the Optima connector attached to the needleless connector to prevent exposure to medicine. Gather all the used tubing and IV bag. Place in a plastic bag that zips closed and seal the bag. Place pump back into pouch. Zip it closed and return it to MD Anderson. Remove the outer pair of gloves and throw away with normal household trash. Keep the inner pair of gloves on for remaining steps. Now you are ready to flush your catheter. With the inner pair of gloves still on, open the Optima injector package and leave it in the package. Remove the cap from the pre-filled saline syringe and push the air out. Attach the Optima injector to the pre-filled normal saline syringe and remove plastic end cap. Place syringe with Optima injector onto towel or pad. Using a CHG or an alcohol swab, clean the rubber surface of the Optima connector, which is attached to the catheter. Let it dry. If using CHG swab for 5 seconds, dry for 5 seconds. If using alcohol swab for 30 seconds, dry for 30 seconds. While firmly holding the needleless connector with one hand and the barrel of the normal saline syringe with the other, push the saline syringe with Optima injector straight into the Optima connector until you feel and hear a click sound. Unclamp the catheter tubing. Flush the entire contents, 10 milliliters, of the syringe using the push-pause method you were taught by the nurse in Vascular Access and Procedures, or ATC. Remove saline syringe with Optima injector by pulling straight back. Place the syringe and injector in a puncture-resistant container, such as a metal can or glass jar, and throw away with normal household trash. Remove Optima connector from the needleless connector that is attached to the catheter and throw away with normal household trash. Do not remove the needleless connector. If you have a portacath device, scrub the needleless connector with CHG or alcohol swab. Connect heparin and flush as directed by a nurse in the Vascular Access and Procedure Center, or ATC. Remove gloves and wash your hands with soap and water. You'll receive patient education handouts about your CADD VIP pump and Optima home system. If the Optima injector suddenly disconnects from the Optima connector, follow the instructions on the patient education handout called Optima Closed System Home Care Use with CADD VIP Ambulatory Infusion Pump. If you see any fluid leaking from the Optima system, stop the CADD pump infusion. Follow the spill instructions in your spill kit, and call the ambulatory treatment center or go to the nearest hospital emergency center if it is after hours. Be sure to review the patient education handout, Safe Handling of Chemotherapy at Home, Receiving Chemotherapy Infusions at Home, and watch the CADD pump videos on MyChart if needed. Contact the ATC clinic for any issues or concerns. These contact numbers can also be found on the CADD pump patient education handouts.